Tapos sabi ng mga katrabaho ko na nagsa-sidecar, magpakonsulta na ako sa doktor para malaman ko kung ano yung sakit ko, kung nakakawa ba ito. Yun, ubo ko ng ubo, tapos pumunta ako sa center, nagpakonsulta ako, tapos sabi ng doktor may tubig raw ang baga ako kasi sobrang napabayaan ko. Tapos sabi, sa loob ng 6 na buwan dapat tuloy-tuloy ang gamutan ko. Ako naman po, si oo lang. Ang iniinom kong gamot ngayon ay yung binigay sa akin na nireseta. Pero yung talagang gamot na iinumin ko, hindi ko napagandaan. Mag-iisang taon na akong tumigil. Gusto ko nga sanang bumalik dun sa center na yun para makapagpakonsulta. Kaso naman, nahiya na ako na pumunta pa ulit. Sinabihan na kasi nila ako dati na binigyan na raw nila ako ng pagkakataon na makapagpagamot. Binaliwala ko lang. Nitong 2 weeks ago ko lang nalaman na may TB pala ako. Kasi nung nasa bangketa ako, hindi ako agad-agad nauwi ng bahay para makapagdilihin siya ng madami-madami. Kaya pag naulan, nababasa ako. Yun, pag nabasa yung damit, natutuyo na lang sa katawan. Sobra pa yung paninigarilyo ko, kaya siguro nakuha ko tong sakit na to. Pero nung nalaman ko na may TB ako, binawasan ko na ng paunti-unti yung bisyo ko. Kasi nakaranas na ako na bago matulog, nahihirapan akong huminga. Ngayon, nahiya ako makipag-usap sa mga tao kasi tuwing magsasalita, tapos uubo ako. Kaya pag may nagtatanong sa ibang kakilala ko na lang pinapakausap.
There are 4 types of TB. So usually your type 1 is also called your TB exposure. They are usually the ones who have a history of exposure but they have no signs and symptoms. They are negative for PPD or tuberculosis test. It's a skin test. And they are also negative for chest x-ray and the other examinations such as sputum. For type 2, you call them your latent TB or PTB infection. Okay, they are the ones who are usually positive with the PPD or skin test, but they have no signs and symptoms. Okay, their chest x-ray is negative. They are also negative for the sputum test, and they are also negative for culture, TB culture. And then you have your PTB3, you also call it your PTB disease. Okay, so usually we have about 5. So you have exposure, you have your signs and symptoms, and you have your x-ray. You also have your sputum exam, and you have your culture. If 3 out of those 5 you have been positive, then that's the only time you are going to be diagnosed with PTB disease or PTB3. And then you have your type 4. Most of these people, they are diagnosed because of chest x-ray. Okay? They have calcification. If we say we have calcification, they are usually patients who suffered from PTB before, but usually since they have not underwent treatment, or if they have underwent treatment, it was too late already, and usually the TB is being controlled. That's why it causes fibrosis, and this can reflect as calcification in the chest x-ray. Philippines is considered as a developing country. If you say it's a developing country, most of the people usually live in a crowded area. In short, we are poor. Okay, so most of the time, if you live in a crowded area, it's usually you are prone to this, especially aerosol. The means of transfer of tuberculosis is usually aerosol. So when we say aerosol, it's in the form of nucleus coming from droplets. If you say droplets, for example, if I talk to you, I usually give out droplets that you cannot see by the naked eye, but I'm already transferring something to you. You'll never know.
Well, actually, wala namang pinipiling social class ang TB or life status. Usually, mahirap man or mayaman, nagkaka-TB. Majority ng Filipino exposed na sa TB. But yung mga mahihirap, sila yung mas nagre-present ng symptoms kasi hindi nila naaagapan agad. At the same time, sila yung mas exposed. Mas prevalent kasi talaga yung TB sa those people with lower social economic status. Pero lahat pwedeng tamaan ng TB. Common partners ng TB, DM, diabetes mellitus, type 1 and 2, HIV, cancer. Wala naman difference yung ginagawa ng PTSI tsaka dun sa mga government treatment facilities. Tinutulungan lang niya yung mga places na walang health centers. Minsan, yung mga lugar na walang health center, merong branch yung PTSI. But with regards to medication distribution, treatment, pare-pareho lang. Standard kasi yan. Standard yung treatment ng DOTS for yung mga normal na TB lang, tsaka yung MDR-TB. Pare-parehas yan nationwide.